Welcome to Dialogue with Dr. D, where we coach for personal, professional, and spiritual empowerment. I'm your host, Dr. Dee Carroll. Do you consider yourself healthy, or are you unhealthy and don't really give much thought to your health situation? You go about your day consuming what appeals to you as opposed to what's healthy for you. Today we're going to discuss transitioning from a state of poor health to a position of well-being. Joining me today is Zerxazer Coyote. As Deputy Project Director of the AAHP, she shares the annual Health Freedom Walk and assists in the coordination of its various programs and activities. Zerxazer earned a BS degree in nursing at Trinity Washington University and embraces all aspects of health and wellness. Also joining us today is Dr. Carmel Wiseman. Dr. Wiseman is an internationally board certified diplomat in clinical chiropractic pediatrics. Prior to her doctorate, she earned 2 undergraduate degrees at the University of Tennessee. Her model of healthcare is holistic in nature and individualized. Her paradigm encompasses the interrelated elements of health, structural, emotional, and chemical. Welcome, ladies.
Thank you.
Thank you, Dr.
I am so glad you could join us today. I'm especially glad because we're going to show our viewers or share with them 2 different perspectives on health. One, a traditional means, as well as a holistic means. So, Zerxazer, you're coming to us from a traditional avenue in that you have your program and you have 6 different areas that you'd like to discuss.
Yeah.
And of course, Carmel comes to us from a long, lustrous career in the holistic health and wellness. Zerxazer, allow me to start with you. Tell me about your program.
Well, the African American Health Program started in 1999 under the Montgomery County Department of Health and Human Services. The reason being because they wanted to address health disparities that existed within the African American, African, and Caribbean descent population, and also to increase awareness in the number of years of life for those that live in the county. So we offer a lot of programs to provide health outreach and education to those specific communities.
Wonderful. And you head up that program, or you are the assistant deputy?
I'm the Deputy Project Director, which
Okay.
encompasses a lot.
Okay.
But like you said earlier, I do chair our annual Health Freedom Walk, which addresses cardiovascular disease, which I'll talk about a little bit
Okay.
further. But then I also assist in the coordination of our various programs that target our 6 areas of health that we focus on.
And what are those areas?
Well, the first is infant mortality. And that addresses pregnant mothers and providing them with support, prenatal care, as well as when they deliver with breastfeeding. We have diabetes education classes that are free to minimal charge for our Montgomery County residents and those that live outside of the area. We also offer HIV, AIDS, and STI counseling as well as testing. And we do a lot of work with detention centers as well with that program. We also offer cancer referrals to neighboring hospitals. We have an oral health component where we refer our Montgomery County residents if they need dental care.
Wonderful. That is a powerful program. And talk about empowering the entire community. How do you ensure that the residents of Montgomery County is aware that these services are available?
Well, I actually started with the African American Health Program as a health promoter. And so we have lay people or, different residents of the county that are interested in health and want to become more active and involved in increasing awareness in the community. So that's how we do a lot of our outreach. We have health promoters who go out into the community and provide that education to them. We also partner with faith-based organizations as well as other corporate organizations to help provide that information and increase health awareness in the community.
And you mentioned that it's little to no cost
Yes.
for the residents.
Yes.
How is this program funded then? Somebody has to pay something.
Yeah. Well, our primary source of funding is under Montgomery County Department of Health and Human Services.
Okay.
If we are able to acquire grants, that's when we're working with other community organizations because again, in order to increase awareness, we're working with a network of organizations. In the African American community, even history shows that the church has been a pivotal source of information and where people can go to receive confidence and trust from their pastors. And so we utilize a faith-based community when we're trying to establish different programs.
I'm really excited about all of what you offer, but two things are in particular interest, and that is the infant mortality as well as HIV/AIDS.
Yeah.
Tell me, do you have high participation in these programs? What's happening with it?
Well, with our infant mortality, we have a home case management program. It's named SMILE, and it stands for Start More Infants Living Equally Healthy.
Oh, wonderful.
So we have nurses that provide one-on-one education to pregnant mothers, and we start off from the time that they find out that they're pregnant and provide them with information through their stages of pregnancy. When they deliver, we're in the home taking care of or providing them with education so that they know how to properly take care of their infant when it comes to child safety, which is very important, as well as breastfeeding support. So we provide that not only to the moms, but providing support for the fathers too, to let them know that they have an integral role in making sure that nutrients are provided for their infant.
Yes, yes. That's very interesting. You say it's for the African American community in particular. Would this include, or is it limited to low-income families, or is it shelter people or living in different facilities?
The program is open to everyone of all economic statuses.
Great.
The myth is almost that infant mortality is for those who are low income, but it's also seen that it can occur in those who are highly educated as well. So we try to specifically educate those who are not only of low income.
And do you have high participation from the residents? What percentage? In fact, let's have you answer that when we return. Also, when we return, we're going to hear from Dr. Carmel Wiseman. We'll be right back. Stay tuned. Welcome back to Dialogue with Dr. D. I'm your host, Dr. Dee Carroll, and joining me today is Xerxazer Coyote and Dr. Carmel Wiseman. Just before the break, we were talking about percentages. And Xerxazer, you're going to share with our viewers the percentage of participation in your programs offered by the county.
Well, since our program is a Montgomery County funded program, We pretty much have 100% participation from Montgomery County residents. Now, if those who want to participate live outside of Montgomery County, we certainly welcome them to participate as well, because health awareness is health awareness.
Yes.
When it comes to our SMILE program, which I said stands for Start More Infants Living Equally Healthy, our nurses do a superb program on increasing awareness on breastfeeding, and currently we are at we're higher than the national rate for African American women breastfeeding. So we're really proud of the accomplishment that our nurses have done with that.
Amazing. And the percentages?
I believe the national average is 58% for African American women, and our program is at 66% of our women enrolled who are breastfeeding.
Wonderful. And it's amazing how times change. You know, you can remember your parents, you know, breastfeeding, but then all of a sudden it wasn't kosher anymore.
Right.
And then all of a sudden, let's do it again.
Because time frame, sometimes it's a matter of time.
Yes.
Women going back to work sooner. Formula is made easier nowadays. So we'd like to encourage that, you know, breast is best. That the nutrients for the infant is vital for them as well as for the mom.
Wonderful. Thank you. I appreciate your enlightenment, and I certainly hope our viewers will take advantage of all that you're offering.
Thank you.
Dr. Wiseman, we're so excited to have you, in particular as you share a holistic approach to health and wellness. Tell us about your approach to this whole holistic thing that is buzzing like crazy across the world today.
Very true. It has really become quite the buzz. And I became involved even way before I became a chiropractor 10 years ago. I grew up with a very holistic frame of view, and I love what it can do for my patients. I love what it can do for my family and friends. I really like to look at the person as like this very large web of all kinds of systems that are interrelated, and they work all together. And if you take one of the pieces, like we talked about the chemical, the structural, the emotional components of health, if you impact one, you're impacting everything in the system. It's not very compartmentalized. It's actually quite the opposite. It's like this very large view of our health.
Yes.
And it's a lot of fun. It's a great discovery and exploration. Each person is so different. And chiropractic has really given me such a huge opportunity to make a difference in people's lives.
Do you find that if you know it, you love it?
Yeah.
But if you don't know it, you're a bit challenged or afraid, you know, cautious? What are your thoughts?
You're talking about in terms of the patients.
Yes.
Right. Yeah, it's really interesting because when I first started out, I thought, oh, how am I going to convince people? They're so used to going to the doctor, and they have to, if they don't leave with a drug or a shot or something, they feel like they haven't gotten anything. What I actually found in practice is quite different, is that a large part of my patients have come as referrals. So their friends and family have had a lot of success, and they tell them, hey, you listen, this doctor really helped me, chiropractic really helped me, check it out. And you know, in our practice, we specialize in pediatrics and perinatal care. And it's really amazing. A lot of people will start out when they're pregnant because they have some back pain.
Yes.
And they start feeling so much better. And we offer complimentary well baby visit after their baby's born, and educate them about the benefits of and the importance. If I could choose one patient to adjust in this world, it'd be an infant, it'd be a newborn, because the difference I can make in that newborn's life, very similar to the programs that you're doing, it's very significant for the rest of their life, what you do in the first year of life.
Wow.
So they bring their babies, and then the kids start to grow up in the practice, and the parents see that the kids are not as sick as often. and they'll bring their kids to us first when they get sick. And we really like to work actually in conjunction with medical professionals, with nurses. We work with midwives, with obstetricians, with pediatricians, and we cross-refer.
Yes.
Because I think that when you have this honor and privilege to work with a patient, whether it be a newborn or a pregnant mother or somebody's grandmother or mother, it's really such an honor and a privilege, and you want to give them the best.
Well, now it's amazing that you mention the mother, the grandmother, because when I think about chiropractic treatments or adjustments, I'm thinking those are the people that need it. I never would have thought that a newborn would need an adjustment. They haven't done anything to need one.
I know, you would think so. But you think about the time that the baby's in utero. The mother, this brings up a really great point of why many women come while they're pregnant to receive chiropractic care. So there's a thing that's called in utero constraint, and what that means is that the mother's pelvis may be misaligned, so she needs an adjustment. When you adjust her pelvis and create balance in her uterus, the baby has the most space to be able to grow and develop in utero. Sometimes the baby, even with the best of chiropractic care, the best prenatal care, obstetric care, the baby is still stuck in a very strange position. And on top of that, even with the most natural births, the easy birth, right? The moms that come in and say, oh, I had the easiest birth, it came out so fast.
Right.
Even with that, it's as much, if not more traumatic for the baby who's being squeezed through this birth canal, or who's being pulled out with a cesarean section, or whatever the birth may be. It can be very traumatic for the baby. And we often find that when they're born and we adjust them right when they're, we do find misalignments and imbalances in their spine.
Amazing.
Right when they're born. And I've had the privilege and honor to adjust the little ones right when they're born.
Amazing.
Incredible. Yeah.
That is phenomenal.
Yes.
Never even thought of it. You know, I would like to know more about your referrals and where they come from. We're going to take a short break, and when we come back, if you can share with our viewers a little bit about the referrals and that process.
Excellent.
Stay tuned, we'll be right back. Welcome back to Dialogue with Dr. D, where we coach for personal, professional, and spiritual empowerment. I'm your host, Dr. Dee Carroll, and today our topic is transitioning from a state of poor health to a position of well-being. Joining me today is Dr. Carmel Wiseman and Xerxazer Coyote. Dr. Wiseman, before the break, we talked about referrals.
Yes.
And what percentage of your practice is based on referrals? Because I know there are a lot of people that are aware of chiropractic treatments or adjustments, but then you got so many more who are just not aware.
That's definitely true. If I had to guess, I would say somewhere around 80% are referrals. I think those are my best patients too. And some people do just call and say, I heard this is great and I want to give it a try.
Okay. But referrals come in, they're energetic, they're excited, and even though they may be new, but they heard some good stuff about it.
Right, so they're already, the credibility is already there, they're open, and they want to get results for themselves, so they're willing to try something new.
Excellent. Now, your practice spans all the way to Israel.
It does.
Tell us about that.
Well, I am in the process, up until a few weeks ago, I was practicing here in Fairfax, Virginia. And in the practice here, I would say about 70% of the practice is pregnant women and children. We take care of everybody, but that's just primarily what we do.
Okay.
And I'm in the process of moving to Florida, and then as a stepping stone to opening my practice in Israel and Tel Aviv. I've practiced there in the past. I've also done quite a bit of volunteer work with Physicians for Human Rights there, and it's where my family lives, so.
Wonderful.
Yeah.
Now you're wearing some unique looking shoes.
I am.
You gotta share those shoes with our viewers.
I am. So these shoes are very unique in that they have a coil on the bottom, and that's not something you see every day. I remember the first time I saw these shoes, I thought they were the ugliest shoes I'd ever seen until I put them on my feet and I started walking with them. And I fell in love with them. I probably have 8 or 9 pairs today because I've become so spoiled that this is all I enjoy wearing. And they come in different styles, you know, hiking shoes and tennis shoes and sandals.
Do you have an evening wear?
Yeah, like a Mary Jane kind of style.
Really?
Yeah, I do, but I love them because they absorb. The coils are designed to absorb the shock that goes into your ankles, your knees, your hips, and into your spine. So, as a person who works on my feet all day, they feel great. At the end of the day, my feet don't hurt, whereas before I used to be, you know, achy feet.
Can you demonstrate?
Sure, yeah, I'd be happy to. So you can see when I walk forward like that, the coil compresses. They also have a built-in orthotic, so they're very comfortable.
Wonderful, wonderful. Well, thank you. I really appreciate that.
Yeah.
Interesting, and maybe I'll try some.
Yes, I'll hook you up.
Okay, sounds great. Zerxayer, I want to have you share a little bit about your program, your Freedom Walk program.
Sure, absolutely. Well, the first time that I heard about Health Freedom Walk, I was, again, a health promoter. And Jean Charleston, she's the founder of Health Freedom. And it started out in Baltimore City. And what she wanted to do was to address heart health amongst African Americans and tie that to the history of the Underground Railroad. Her concept was that if our ancestors could walk thousands of miles for their freedom, can we take at least 5 minutes, 10, 30 minutes, even an hour to walk to free ourselves from a sedentary lifestyle?
You're touching a sore spot now, okay? That is phenomenal. And yes, that is total awareness.
Absolutely. So this year, it's our 10th year that we are having our annual Health Freedom Walk. She started in Baltimore City, but it's gone through 9 counties in Maryland. So we're really excited just to increase that awareness about reducing weight, being more health conscious, and then we do have a nutrition component as well.
Oh, wonderful.
Absolutely.
That is phenomenal. How can our viewers find out more about what you offer?
Well, we do have a website. They can reach us at www.one, that's O-N-E, healthylife.org. We also use our social media pages on Facebook and on Twitter.
Wonderful. Well, I certainly hope our viewers will take advantage of what you have to offer, because talk about empowerment. That will certainly empower a lot of people. And Dr. Wiseman, can you share with our viewers how they can find you?
Sure. The best way to get in contact with me is through our email address, and that is info, I-N-F-O, at gh-hs.com. And if you want more information about the shoes, you can go to Z-Coil, Z is in the letter Z, and coil.com. There's an online store there, although I do recommend to people to go to the closest store so that they can receive a custom fitting.
Okay.
Yeah.
Custom fitting.
Custom fitting. Yeah.
That is wonderful. That is wonderful. And the closest, you have stores all over the country.
There are stores all over the country. They're not in every single state, unfortunately.
Dr. Wiseman, you mentioned 8 different styles of the shoe?
Oh, goodness, there's many more than 8. I just own 8 at least.
Okay.
Yes.
Okay.
There are all kinds from hiking shoes to tennis shoes to sandals, so all different kinds depending on what people are up to in life.
Okay, well, I look forward to trying those.
Yeah.
And allow me to thank both of you for joining me today.
Thank you so much.
And
Thank you so
sharing,
much.
Thank you.
yes, sharing
My
your
pleasure.
program.
Yeah,
I
absolutely.
appreciate it. Stay tuned, we'll be right back. Welcome back to Dialogue with Dr. D. Our topic today is transitioning from a state of poor health to a position of well-being. Health is yours for the getting. You can reimagine how you want your life to be. If you can dream it, you can do it. We will provide support and structure as you realize your goals. Don't delay. Embrace your goals now.